Well, good morning, and thank you all for joining us here this morning. And special thanks to Dr. Rice for her very kind words of introduction. Celina and I are really, really pleased to be able to announce our partnership to save the lives of women in some of the most remote parts of Africa. We heard, we heard a little bit about the cancer moonshot this morning, and I'd like to think that we're a small part of that for women who just wouldn't have any chance at all for diagnosis of cervical and treatment of cervical cancer. You know, it's estimated that there are 93,000 women in sub-Saharan Africa who have cervical cancer, and more than half of them will die. And of those, 250,000 children will be left without their mothers. 250,000 children left without their mothers. And of course, we know that women who are HIV positive are much more likely to develop cervical cancer. And this, in addition to this really big public health issue in Africa, this is very personal to me as well, because I have a very close family member who's a survivor of cervical cancer. Celina, do you want to pick this up from here?
So over the last 30 years, cervical cancer deaths have dropped significantly in much of the developed world. But these rates have continued to rise in less developed countries. 87% of cervical cancer cases occur in low-resource settings. While this cancer is completely preventable and treatable, and it's at a low cost, the disproportionate burden in low-resource settings is largely due to limited access to essential prevention, screening, and treatment services. Pink Ribbon, Red Ribbon is a public-private partnership aimed at catalyzing the global community to reduce deaths from cervical and breast cancer in sub-Saharan Africa and Latin America. Partnership is essential to our work. By building upon existing health platforms, infrastructure, and resources, we're able to bring cervical and breast cancer services and education to girls and women like never before. Pink Ribbon, Red Ribbon works with national governments, non-governmental and multilateral partners, the private sector, and key in-country leadership. Pink Ribbon, Red Ribbon partners to deliver services on the ground in each of our countries with the coordination and technical services of a small headquarters.
For those of you who don't know PCI well yet, we're a global health and development organization, and for more than 50 years have been fighting to treat and prevent disease. We've been working in Africa now for 20 years, since 1996, on HIV and AIDS. And together, Pink Ribbon, Red Ribbon, and PCI are working on a solution for cervical cancer. Through our mobile cancer treatment facilities, we're taking testing and treatment directly out to women for whom, in the past, there was no possibility of them being diagnosed and treated for it.
Zambia has the 4th highest rate of cervical cancer in the world. Zambia also has one of the highest HIV rates in the world, with a prevalence of 15.1% in women over the age of 15. This means that almost 500,000 women are living with HIV/AIDS, and these women are 5 times more likely to develop cervical cancer than their HIV-negative peers. Many of these women live in remote rural areas, so it's harder to reach them for health services. To address this gap, we're working together with cervical prevention and treatment to get it where it's most needed. Through the combined efforts of Pink Ribbon, Red Ribbon, and PCI, we're able to reach more women in rural Zambia through mobile outreach and harnessing the power of communities and women's groups.
The good news is that since 2011, we have screened more than 15,000 women. And I was in Africa this summer, Zambia, Malawi, and several other countries, and I saw this program at work. It's cost-effective, it's simple, and it works. And I believe without question that we're helping to save lives in this work.
So today, we're announcing a partnership between Pink Ribbon, Red Ribbon, and PCI to expand our work and to reach even more women in Zambia and to look to expanding our work across Africa. Together, we plan on raising $6 million to scale up our work and to offer screening and treatment to hundreds of thousands of women. Seeing is believing, so we would like to share with you some of our work and introduce you to a very special woman named Evelyn.
Mulishani. Panono. Nichi mwaidile ku checking kulia ku cervical cancer screening.
Nale kumalo kadi name shifuja defu. Roda fikie pakempu pala. Waisa mpima HIV. Asa ngira tishikwete. So fura ile kuli cancer. Apa kwenda. Kai bashirenje bati ifichisa chidi nefironda so chirefa kwa kufunia fye kwisala fye kufyashi nishi no kupola wapola mpira natukwetesha kwira ikai kunondi batata balifa
namwe buchita understand ubulwele bale michita suspect at namkwata ko bwingafika
tati ndisho kweshiba uti nashiba ngefo fina kai kuchifuma mukulwala kufa omuntu kai fina ndechula ndelwala
mulina miaka inga
34.
As you saw yesterday, as part of our outreach, and we followed our client to go and see how she was doing and also see that she could be brought back here to the clinic. And she's gotten her results, and apparently the results have come out to be high on our side. As far as she was concerned, it was a death sentence. It's because of the partnership that we have with Pink Ribbon that these people can get very good help.
We know that worldwide, the commonest malignancy for women is breast cancer. But when you consider sub-Saharan Africa, the commonest cancer in women is cervical cancer. 80% will die. And that's why the whole of the sub-Saharan region is struggling to put together programs for early prevention, early detection, and treatment. A number of African countries has partnered with Pink Ribbon, Red Ribbon, that is run by the George Bush Institute to assist in the control of cervical cancer.
When I was growing up, lots of women and men, including myself, had no idea that cervical cancer was a silent killer. It is a sexually transmitted disease. A woman gets it from a man who has the HPV virus. Probably after 10, 15, 20 years, that's when a woman starts to notice some symptoms. That is why the screening program is very, very important for us, because we're not at a level where we can treat a worst case scenario.
I thought of being screened because we know when someone is HIV positive, it's most likely to have this cervical cancer. I met George Bush. He came in when I was being screened. I had pre-cancer. So my problem was discovered early. Some friends, they fear to come. They'll come. I'll encourage them to come.
In Africa, the notion to go to a doctor, you got to be really sick to look for medical help in Africa. And so we first have to bridge the first barrier within the women themselves. One of the innovative ways is in the see and treat itself. You can then take it closer to the population that requires it, okay? A single visit operates for diagnosis, it operates for treatment.
We start with the free HIV and AIDS counseling and testing, and then we offer the other services, which include cervical cancer itself. The ladies do a screening and find that this person has some lesions that are able to be treated. We actually treat on site. When we find that these lesions are so big and so deep and we can't cryo right there, we actually do a referral. A person can be able to get treated.
Yesterday, after the church service, there was this announcement that there will be some health services. So, well, we thought it's better we go. For us to live longer together, when you are true with the one you love, things become easier to do. You cannot do everything yourself.
And that's the urgency of the whole issue. We need to preserve the health of our women. And if this woman is not there, the whole family just crumbles. Pink ribbon, red ribbon, coming to the aid of countries. This is a very big plus. There are many people that do work such as we do, but we feel particularly privileged. What you're doing here gives us hope that we'll have the support that we need to continue this work next year and the year after.
The time we are living in is very, very different. The young generation, at a very tender age, you see them passing away. I'm now with the grandchildren. They're still very young, and we're trying by our best to give advice for them to live longer than us.
Good morning, everyone. Thanks so much for being with us today. I've seen this video a number of times, and I'm always so deeply moved by it, and I'm sure you all were as well. And I think we're all very enthused to be here to be able to talk about how to have a brighter future for women like Evelyn. So thanks for coming to be a part of that conversation. Thanks to Concordia for giving us this opportunity, and thanks to Secretary Rice for her remarks and her leadership of Pink Ribbon, Red Ribbon. And congratulations to Celina and George for this morning's announcement. We know you've been working together for a while, I think 5+ years in Zambia, but with this new approach, you're going to be able to do so much more for so many more women. So it's a great pleasure to welcome Ambassador Deborah Birx to the stage. Ambassador Birx is Ambassador at Large and U.S. Global AIDS Coordinator. She has a 3-decade-long career in global public health and a record of remarkable achievement. She's been a most committed member of Pink Ribbon, Red Ribbon, and quite frankly, so much of what we've been able to accomplish over the last several years has been due to the generous support of the U.S. government. I'm also really so pleased to have Irma Alfaro-Beitz with me this morning. Irma is the Vice President for Global Health Policy at QIAGEN, and in that role, she works on bringing innovative diagnostic technologies to low-resource settings, and in Zambia has been working in particular on an HPV diagnostic technology that we're very excited about because it's going to allow us to reach a lot more women a lot more quickly. We have a number of Pink Ribbon, Red Ribbon supporters in the audience. Thank you all for everything that you do, and a special welcome to John DeMonte, President of Bristol-Myers Squibb and a board member of the Pink Ribbon, Red Ribbon. My organization, the Joint United Nations Program on AIDS, works on global AIDS, and we have a goal of ending the AIDS epidemic as a public health threat by 2030. But we know we are not going to be successful in doing that unless we also tackle cervical cancer. So when President Bush proposed this initiative to my executive director, Michelle Sidibe, we really came to it with great enthusiasm. I've had the privilege of being a part of this effort since it was first launched exactly 5 years ago this month, and it's been an extraordinary experience. And I have to say, I think for all of us who've had the opportunity to work on this, we've been really deeply touched by the depth of the need and the tremendous potential to do more. And to do more with really minimal additional effort and very modest cost, but to do it in a way that it really fundamentally affects the future of women and their families and their communities. So when I think about pink ribbon, red ribbon, I really think that it speaks to the best of the American national character and the best of what we can do as a global community. And just as an aside, 3 of us actually live and work in Washington, D.C., which is a city that's not really known for agreement on many things these days. But on issues like PEPFAR, on issues like pink ribbon, red ribbon, there is still a very broad and strong consensus on the importance of our support and making sure we drive these programs forward. So we're thrilled to be welcoming new partners to Pink Ribbon, Red Ribbon so we can have even greater impact. The evolution of our partnership model has really been exciting. We have everything from the major global pharmaceutical companies to small grassroots NGOs to ministries of health and ministries of finance. I think we're now up to 25 members, and in each of the 5 pink ribbon, red ribbon countries, they're pioneering new and exciting ways of delivering services to women. So without further ado, I'd like to get to our terrific panel, and I'm going to start with Celina. So Celina, could you please tell us, why is cervical cancer important? What type of burden does it pose? And what do we need to do to ensure a better future for women like Evelyn?
Thanks, Lisa. So cervical cancer is a really important issue because it affects so many women. About 276,000 lives are lost every year. And it kills women when they're in their 30s, their 40s, and their 50s. So right at the point when they're raising their children, they're the most productive members of society. So it really hits at a terrible time. And it's a completely preventable and treatable disease. So what we're trying to do is prevent cervical cancer from actually happening. Cervical cancer is caused by HPV, the human papillomavirus, which is a really common sexually transmitted infection. And in most people, when they catch this virus, their body eventually just gets rid of it and it's fine. But in a small percentage of women, it progresses and you have it for 10 or 15 years and eventually it leads to cancer. So the first way that we prevent cervical cancer is by using the HPV vaccine, which is safe, affordable, and effective. So we're working on scaling up access to the vaccine in sub-Saharan Africa. The second thing is that we have this 10 to 15-year window generally to identify women that are in the process of moving towards cancer. And if we can find those women before they have cancer, we can treat it for $25. And the price of that is even going to go down in the next couple of years. So this is a really affordable, effective intervention, and we can integrate it very well into existing services with reproductive health and with HIV. So by working with partners like PCI, we can reach the hardest to reach women and the women that are most at risk. And that's why this is a really valuable partnership for us.
Great, thank you. Thank you, Celina. And let's go to Ambassador Birx. Debbie, can you say a few words about why the President's emergency plan for AIDS relief should care about women's cancers, and how does being part of Pink Ribbon, Red Ribbon strengthen what PEPFAR can do?
Great. So I really loved the opening this morning when they talked about how, in order to solve the big problems, we have to have an integrated solution in their opening this morning, because that is very clear. And the exciting thing about PEPFAR is we're able to take the solutions that were just discussed and take them to scale through the U.S. taxpayer dollars. So when PEPFAR was established by President Bush in 2003, it was expanded by President Obama. So what is more indicative of an amazing bipartisan support? But President Bush came back to Secretary Clinton with these statistics about how we have saved young women, 34-year-olds who have children, from HIV death, only to have them die from cervical cancer. And so Secretary Clinton announced Pink Ribbon, Red Ribbon with President Bush as part of a PEPFAR initiative to really bring to scale these life-saving services that we just talked about. Prevention. Now I'm just going to put out one key thing about why this is so important to PEPFAR. It's all about demographics and geography. And if you look at the demographics of sub-Saharan Africa, we have 100% more 15 to 24-year-olds, just at the verge of sexual debut. Now let me repeat that, 100% more, and increasing every year. So we are strongly supportive of primary prevention through immunization of young girls, and we are very supportive of secondary prevention because it continues to strengthen a holistic approach to the health system. But what have these two things pointed out to us, and this is the second reason why PEPFAR is very interested, is you start looking at where the health system has been strengthened. And so because of the great work of many people in here and PEPFAR and the Global Fund, we have great work for under 5. So if you're under 5, you can access the health system around wellness, around immunizations. If you are pregnant, you can access the health system around wellness and a good outcome. If you are over 5, or if you're not pregnant, or you're a male, there is not, as was described in this tape we just saw, access to the health system. So part of what PEPFAR can do now with this increase in the demographics and really understanding that demographics of 15 to 24-year-olds, and then understanding where the health system needs to be strengthened, working on immunization, because the only way to reach a 10-year-old and 11-year-old is integrate the health system so that they reach those individuals. The only way to prevent cervical cancer in someone who is not pregnant is to have wellness. And the only way to prevent the spread of HIV is to find the 25 to 35-year-old young men who never interact with the health system because they don't believe they need to until they're sick. So what Pink Ribbon, Red Ribbon does for us, in addition to what we work on with HIV every day, because we're convinced that we can bring the solutions to scale to change the very course of this epidemic, and that's why President Obama announced we would create an AIDS-free generation. But it also says to us, if we strengthen the health system, we reach people that allow the sustainable development goals to be achieved, to really deal with non-communicable diseases. Because now you have a health system that understands wellness and seeing people every 6 months rather than every month, and creating a sense of healthiness, because we know that that's what brings the strength of the community. We know democracy, governance, wealth, and stability. The thread that runs through that is the health of the communities. And so this is why the US government continues to support PEPFAR. This is why we're excited about Pink Ribbon, Red Ribbon, and continue to support it, because it allows us to continue our data-driven finding solutions for tomorrow, utilizing data and driving towards that new goal, not where we have been, but where we need to go together to both end AIDS and end cervical cancer.
Thank you very much, Debbie. So much of what we need to do is really about building systems and getting people into systems. And we know that the private sector is a fundamentally important partner in doing that. So, Irma, let's go to you to say a few words about, from your perspective, what's the value added of working in this kind of partnership? And just tell us a few words about this HPV diagnostic technology.
Good morning, and thank you for inviting us to be part of this wonderful panel. At QIAGEN, one of the many areas that we focus on is cervical cancer. We know many countries have low screening coverage, and so with that, we worked on a test in partnership with PATH called the CARE HPV test. It was developed by QIAGEN. It detects the HPV virus. It is a molecular test, and one person can test 90 patients in approximately 3 hours. It's a technology designed for areas where there's low infrastructure, no laboratory infrastructure, remote settings, and even mobile clinics. It will give you a positive or a negative result, and it has a very high sensitivity compared to other technologies or other ways of doing things right now. We believe that by incorporating this technology, we should be able to increase screening coverage. Now, within QIAGEN, we have a program called QIAGEN Cares. It is a donation program that is designed to allow countries to evaluate these technologies within their public health programs. But from the moment that we launched this program, we realized that without key joint partnerships, we would not be able to have the impact that we would like to have. And that is why when we do these evaluations in countries, these partnerships are so important, like in Zambia. Whenever you're bringing in a new technology, there will be gaps that will exist. And so these partnerships come around to fill those gaps, but also from the moment a patient specimen is taken to the moment that that patient result is given to a medical staff for them to determine next steps. There are so many areas that these partnerships are imperative to support the Ministry of Health. Ministries of Health on a day-to-day basis have so many priorities, and in order to set up that infrastructure that will make it long-term and sustainable, that this is where those partnerships are important. We really believe that by considering and utilization and implementation, sustaining these technologies, we should be able to increase the screening coverage and therefore have an impact in reducing the incidence and mortality rates of this disease.
Thanks, Irma. So much of what this is about getting services and diagnostics and treatment and screening directly to people and to people in some of the most remote parts of Zambia and other places in Africa as well. And George, you've really at PCI been at the core of doing that for many years. We know you've just come back from Zambia. Please tell us a little bit about the model PCI is evolving, particularly the medical mobile outreach model, and what you saw on your trip.
Sure. Thanks very much, Lisa. I'll pick up on a description you used a minute ago, reaching the hard to reach. Reaching the hard to reach. That's what PCI does. We have a long history of working in some of the most remote parts of the world, dealing with some of the most critical health issues, and bringing people into the healthcare system that normally would not be part of it. How do you bring these women into the healthcare system? And through these diagnostic and treatment facilities that we were doing on a mobile basis, we're able to engage far more people in the system than would normally be the case. We've screened more than 15,000 women with Pink Ribbon, Red Ribbon, and the PEPFAR funding. We are very hopeful to deepen this program in Zambia and extend it to other parts of Africa, countries that are so hard hit by HIV and AIDS, like a Botswana or in Ethiopia, where these kinds of services just are not available. And when you couple that with our public education program with girls in schools, and you bring along the HPV vaccine, I think we have the potential of bringing along a cervical cancer-free generation, and I'm very excited about that.
That is exciting, and so much of what we're trying to do is look ahead. And even as we do this really fundamental work now, to build the foundation, we need to already be thinking about how do we sustain it. So, and that's something where actually Pink Ribbon, Red Ribbon has really tried to be very deliberate in terms of working with the national governmental partners. But I'd be interested, maybe Celina, I'd start with you. Just give us a few thoughts on what's the most important thing for us to be doing to put this partnership on a sustainable footing with our key national partners, so that when Pink Ribbon, Red Ribbon is done, 5-10 years from now, the programs are scaled up and reaching all the people, reaching that huge demographic group that Ambassador Birx mentioned.
So one of the ways that we work is by creating a partnership with the government, and we fund positions within the Ministry of Health to write a national cancer control plan that is costed. And we have examples now in Zambia where the Zambian government has completely costed their plan and is taking over the funding over that plan over the next few years. And so we know that the countries are stepping up in that way, so we can show that the funds are going to be put to good use and the governments really want to spend these funds. Our funds for cervical cancer are pretty limited, and so we really need the government to be in partnership, and so we work really closely with them and also with advocates in the country, such as the national networks of people living with HIV. And by getting them to show that this is really important and to talk to their leaders, we can get increased government commitment.
Debbie, any thoughts on that question?
Yeah, I just want to pick up the public education piece because I think that's really extraordinarily important. You could hear from the woman's statement, we know that illness leads to death. That statement alone would keep people from the health system because they would realize when they go, that's the statement they're going to get. So I think along with sexual education and our education initiatives to really improve and get girls into secondary education, creating messages around preventive medicine and health will be the extraordinary next step that we can do together. And I think talking about that, even in the United States, I remember in the 60s and 70s, cancer was incredibly stigmatizing, incredibly stigmatizing. No one talked about cancer. Then no one talked about HIV. So these large pandemics and these issues people don't speak about. We need to talk about it here. We need to make that social media. Those of you who work in social media, those of you who have access to people who came of age during the millennium. I won't call them millennials anymore because apparently they don't like that comment. So those who came of age during the millennium, who understand how to utilize social media, who understand how to do that outreach, making cancer not a death sentence is important to all of that, and that comes from knowledge, that comes from awareness, and that helps us with the stigma and discrimination that still exists in HIV, but it will help also in cervical cancer.
So we're a little tight on time, and I want to make sure we have a few moments for audience questions. So why don't we go to all of you. And please just identify yourself and your organization. And if there's a particular panelist you'd like to direct your question to, please do that as well. So we'll go to the gentleman here and then the gentleman up in the front.
My name is Ben Anderson from the Breast Health Global Initiative based at Fred Hutchinson and University of Washington in Seattle. I was interested, Ambassador, you made the point of not talking. The title of this is Women's Cancer in Africa, and you've only spoken about cervical cancer. My interest is in breast cancer in low and middle income countries, and it is more complex than cervical. Clearly, you have to do cervical first. But what is your thinking about how to go to that next level of other non-communicable disease-related cancers and how that might fit into the healthcare systems building that you're discussing?
Thank you. And let's take this second question right in front at the same time, and then we'll come back to answers, please.
World Health Organization, and I spend a lot of my time at the WHO to develop all of the guidelines you are using now, the HPV vaccine, the cervical cancer screening, and the pink book, we call it the big book. My question is about the role of the UN in helping setting up the national system to absorb not only cervical cancer, but also breast cancer, NCD in general. How can we are still in silos. We have HIV systems, tuberculosis systems, we have every woman, every child strategy, NCD strategy, HIV. How do you see who could bring all these three pillars together?
Great. Thank you. Thanks for both great questions. So why don't I maybe, Celina, let's go to you first for the first question and then to Ambassador Birx and any other panelists. So where do breast cancer and other women's cancers fit into our work?
Thanks, Ben, for your question. Breast cancer has been a little bit more challenging for us to figure out at Pink Ribbon, Red Ribbon, and I think with all of our partners, but something that we're very committed to. What's harder about breast cancer is that it's not something we can prevent. It doesn't cost $25 to treat. So what we really need to do with breast cancer is to identify women early so that we can treat them, because we can help them survive breast cancer if we can identify them earlier. And we also really want to build upon the same platforms that we're learning for cervical cancer. So as we learn how to bring women in for screening, and we screen them for cervical cancer, we should be screening them for breast cancer at the same time. It's definitely more challenging. I think it's something that the partnership has struggled with, but there's really a strong momentum to do it now, and something that we're very committed to.
Do you want to answer the second part of the question related to multilaterals and other?
So it's a great question. We consider the multilaterals to be very much a part of our partnership, and many multilaterals are officially part of Pink Ribbon, Red Ribbon, including UNAIDS, which is one of our founders, the IAEA, and others. So we consider it to be really important. All the work we're doing is based on the guidelines. I think one of the challenges we have is that this is a space that's evolving really quickly, and we have new technologies such as the one that Irma was talking about, and those haven't all been reviewed yet by the World Health Organization, and getting those approved and reviewed is really, really important so that the countries know what they should be doing, so they're always responding in a very careful way according to the best guidelines. And it is a little bit of a challenge now when we're missing some of those guidelines. We need to move faster, and that's always hard when we're a small community with limited resources. But we see the role of the UN as being essential.
I just find those questions really very much related, because we all know that you can't manage what you don't measure. And I think both the multilateral organization and PEPFAR need to strongly support, as well as all of the private sector, collecting and analyzing the data around these health issues, because they're absolutely key. And I think we all need to be part of that data revolution. No, you don't have to be the ones on the ground collecting it, but you can be the ones that are helping us create infographics and visuals so that the ministries of finance can make the decisions that they need to make around this data. Right now, we believe cervical cancer is more prevalent because women show up with it. But if you're dying from breast cancer, you may not even be reported. And so these are the kinds of things that we can really do together. If I could ask the multilaterals to do one thing, it would be for all of us to consciously analyze what we're doing in the health system and ensuring that we're building towards a health system of the 21st century that moves from brick and mortar in the rural areas to these kind of mobile outreach, and that really addresses the urban poor in a comprehensive way. 25% of sub-Saharan Africa in the last decade has moved from the rural areas at a greater rate and into the urban areas. yet we don't have the health system and the systems to really respond to those informal settlements and the urban poor. So these are the types of things that we should be working on collectively, and to be data-driven and diagnostic-driven. We need to stop the presumptive algorithms, and we all need to be part of that medical revolution that is needed around the world.
I'll add just a quick comment. Your note about stovepipes. All of this work that PCI is doing is built on our HIV programming already in place through PEPFAR. So it is fully integrated, and we could not be as cost effective if that were not the case. The other comment I would make, and with all respect to the UN and the agencies that we all work with, at the end of the day, this is about bringing healthcare into the community level with local organizations, with the local healthcare system, and bringing that up as well. So it's not only top down, it has got to be bottoms up, or it won't stick.
Irma, a thought?
I think it's really important to have cost-effective models, cost-benefit models that could be presented to funders, to global organizations, ministries of health. What you're looking for is that initial assistance to be able to get that support, but then so that it can then be turned over and become sustainable long-term. That's ultimately what you want. And have these models then be replicated in other countries and shared. And a procurement mechanism for many of these countries, that would really facilitate things. It's really important.
So I think we might have time for one further question, and then I'm going to come back. I do not have time for one further question, okay? So I'm going to come back to just a 30-second closing thought from each of our panelists. Please tell us why you're optimistic that over the next decade we can, in fact, make rapid progress on cervical cancer in Africa. George, we'll start with you.
Because we're reaching the hard to reach. These are women who culturally or personally would not be looking at preventive care. They'd only go in if they thought they were, if they would go in at all if they were sick. This is about stopping the disease before it starts.
Thank you, George. Celina.
We have the tools. Right now, we have the tools to prevent the disease with the vaccine, and we have the tools to screen and to treat and to prevent women from getting cancer. So we know this works because we're doing it. We're getting more partners all the time involved in this, and it's a cost-effective strategy that is saving hundreds of thousands of lives.
Two ways I'm optimistic. One, all of the women and girls networks are starting to work together. So Child Not Bride, HPV vaccination, PEPFAR, realizing that we're all trying to reach the same age groups with these life-saving interventions. So I'm super optimistic about that. And I'm super optimistic that we're going to be able to use data to really focus funding where the diseases are, because diseases are not equally distributed. They're in hot spots, whether it's teen marriage and teen pregnancy, or whether it's cervical cancer and HIV. And we've got to use the information that we have so that we can target our resources more effectively.
And just partnerships. I think the private-public partnerships are very key in getting more visibility out there. I think it's very important to highlight how important this is, you know, for the world, actually.
And I'm optimistic because we have all of you with us on this journey as well. So thank you very much for your attention, and enjoy the rest of your day.